Dentists have all kinds of new precautions that they need to take in order to reopen, and turns out patients have new obligations as well. So what should you expect? Well, before you get your teeth cleaned, you may actually have to get your temperature checked. You'll also have to answer some basic questions about potential COVID symptoms you have. How did I do?
35.9.
Okay, Rita, thank you very much. You'll have to wash your hands, wear a mask, and as for the waiting room, it may be off limits altogether.
We just want to ensure that patients don't cross paths as they're coming and going to keep them as safe as possible.
Then there's the appointment itself. Staff will be wearing even more protective gear than they usually do.
So, for example, in addition to eye protection, you may see that the dentist and dental staff are also wearing face shields.
Now, obviously, once you're in, you can't keep your mask on. So your dentist may actually ask you to use a hydrogen peroxide rinse just to pre-clean your mouth. Then come the changes you may not even notice.
So we've really beefed up the HVAC system in the office to purify the air as much as possible. So once we're done treating patients, we have to close the door. We have to let the air be purified before we can reopen the door to come back in to disinfect and sterilize the room to get it ready for the next patient.
If the dentist doesn't have a way of circulating or filtering the air, then they'll have to leave the room empty for 3 hours between patients, depending on the procedure. That's important because so much of what a dentist does in your mouth generates aerosols. Everything from this water spray gun, to high-speed drills, to the ultrasonic scaler that vibrates the junk off your teeth. And it's not like the dentist can keep physically distanced from your wide-open mouth. So yes, a lot of these protective measures in place are to protect the staff here, but they're also here to protect you from the other patients who were in the room just before.